plain unfair. No one can follow that act. Good evening, everyone, and thank you for inviting me to be part of your celebration. I am delighted to be here and to have learned much more about CARE as I spoke to Amy Go in recent weeks and learned about your incredible work and was so thrilled to hear about such an amazing and innovative organization. You have taken a leadership role in helping meet the needs of patients in Ontario and in integrating health workers from around the world into our society. Thank you, CARE, and congratulations on your 10 marvelous years. You know, I'm a journalist who has always cared very passionately about the role of women and equality for women, and so naturally, I was always keenly interested in working conditions for nurses. Nurses and teachers being the two largest groups of working women. And it's hard to believe, but it's 50 years since I was a very young reporter at the Globe and Mail, and I wrote a series about nursing. And the reason I wrote that series was because someone told me, and I found out it was true, that janitors and elevator operators in hospitals, all of them men, and none of them educated, earned more than registered nurses. I was so furious when I learned that I wrote a steaming series of articles about the injustices done to nurses, many of them now overcome by the nurses themselves. And the nursing profession is now amply recognized and appreciated as the backbone of our healthcare system. But I learned then, and I've learned it ever since, that we have to fight for the justice and equality that should be ours by right. And especially nurses who come from elsewhere to this country have faced barriers of ignorance and prejudice in Canada, which CARE has richly helped to overcome. And I welcome CARE's wonderful role in that accomplishment. I'd also just like to take a moment to say that this evening is also a tribute to Joan Lesmond, a person I held very dear. She was a colleague of mine on the board of Women's College Hospital, and her accomplishments, her energy, her character, her intelligence just shone in so many areas of nursing and healthcare administration, and that was a grievous loss, and I'm very proud to be part of a tribute to Joan tonight. You know, I noticed in the program it says, address by Michele Landsberg, and I could just see everyone's heart sinking as they saw dinner receding into the far distance. But I'm not making an address tonight. I'm just here to celebrate with you and congratulate you and speak for only 2 or 3 minutes about what you have accomplished. I want to say above all that Canada needs you, even more than you needed us. You internationally educated nurses are not just welcomed here to fill a gap, but because you are enriching us, you're helping us to build a new global society. And we need your cultures and languages, your understandings of the world, adding to our human experience and adding international depth to our healthcare services. So as an organization, CARE embodies the kind of flexibility and innovation that other schools should follow. I noticed when learning from Amy about CARE how much CARE has responded and adapted flexibly to the needs of its nurses. And that's what every school in every field should be doing rather than imposing a rigid definition of its own. And CARE is an activist organization and works with employers and universities to advocate for the needs of the internationally educated nurses. So here tonight, you're celebrating your first successful decade, amazing, 1,000 nurses, an organization that came from nowhere to becoming an absolutely essential piece of the puzzle that makes up our healthcare system. You are the energy and the inspiration and the gift that immigration offers to this country. We are grateful, and I'm very happy to be here tonight to celebrate with you. Thank you.